So, you've done the visual field test, but now you need to interpret the results. You want to know whether the results are a reliable representation of the patient's visual field and whether any apparent defect is something that requires further investigation. It is important to adopt a systematic approach to interpreting the visual field plot, and this video will take you step by step through how to do this. The first rule for visual field plot assessment or interpretation is to check the details. Check that the patient's name is entered correctly, and then look at the test strategy. In this case, it's a 24-2 CETA standard strategy. Look at the prescription. A high positive or negative lens may give a clue as to whether there is a potential for rim artifact. Check that the patient's date of birth has been entered correctly and that the correct age is shown. This is important as many instruments compare the patient's results with an age-matched normative database. Also check the date of test to be sure that you are looking at the most recent results. The next rule is to check the test integrity. To get an indication as to whether the test is a reliable representation of the patient's visual field, check the reliability indices, that is, the number of fixation losses, false positives and false negatives. The usefulness of these indices will be discussed further in your labs and lectures. The next thing to do is to examine the plots. Firstly, the grayscale plot. That is a visual representation of the sensitivity of the hill of vision and is used as a visual indicator of the field result. The total and pattern deviation plots are beneath the grayscale. The total deviation plot, to the left of the screen, compares the patient's sensitivity values in each test location to the normal aged matched sensitivities. The pattern deviation to the right corrects for depressions in overall sensitivity that might be due to cataracts or uncorrected refractive error, and the pattern deviation plot picks up specific patterns of loss. Then have a look at the visual field indices, that is, the glaucoma hemifield test results and the mean deviation and pattern deviation scores, and see how well your patient's plot results compare with the age-matched normal population. Once you have examined the field plots in a systematic fashion, you should then give your impression of the test results and write them down in the patient's record card. Are the plots reliable representations of the patient's hill of vision, or are they artifacts? Look at the results from both eyes. Is the loss monocular or binocular? How symmetrical are the defects? Are they respecting the horizontal or vertical midlines? These sorts of questions will help you determine the location of the lesion in the visual pathway. And remember, it is important to repeat the test if you find a defect, especially if it's the patient's first ever test. You want to be sure that the defect is reproducible and not just a spurious finding. An online lecture with case examples will be available to view soon. Check CitySpace for announcements. In the meantime, keep in mind the 5 rules for visual field assessment when you're seeing your patients in the primary care clinics.